Hello and welcome. Thanks for tuning into Strategic Self-Care, the 5 approaches to health. Today I'm going to show you a roadmap that will help create context that you can use to guide all the decisions you make about how to take care of your health. Now, most of the advice you get on health is about tactics like exercise more and take these supplements. Today you're going to come away with a more strategic way of organizing and thinking about all those tactics. And we're going to try and do this all in about 7 minutes, so buckle up. Now here's where we start. First, we want to define health so we know where we're going. And the 5 approaches to health will take us there. Now this presentation looks at all forms of healthcare through one very useful lens I've borrowed from traditional Chinese medicine. Now most people define health as a list of goals or aspirations. When you define health as a target, you can aim at that target in a way you can't aim at a goal or an aspiration. So this is going to lead you to see that there are 5 approaches to health, and that's the roadmap, that we're going to put everything into context. So we all know the practice of medicine is complicated, but it does just break down to 2 steps, diagnosis and treatment. Now most diagnoses tell you what you have, but they don't tell you why you have it. So most treatments, therefore, treat what you have, but they kind of avoid looking at why you have that problem in the first place. So when you're defining health, it's great to have goals, and these goals, happy, adaptable, symptom-free, and wellness, those are great goals. Now, if you define health as a target, like strength and balance, structural and functional strength and balance, then you can figure out where you are currently and where you need to go in order to achieve better health. So I'll show you what that means and why strength and balance provides you with such a great target. Now, strength and balance can be represented by this simple bar chart. Strength and balance are not static, so minimal fluctuations in the status of your health, that's normal and healthy. Now, if you've had abnormal fluctuations or unhealthy strength and balance, that can be represented by a bar chart that looks more like this. Now, there's one fundamental law of nature that makes this definition of health really work, and that is duality. So balance is a reflection of duality in all elements of nature. So without duality, the concept of balance just couldn't exist. You can't have hot without the possibility for cold, or expansion without contraction, or dry without the potential for damp. So if everything is relative, that's because of duality. So health excesses and deficiencies can be identified by looking for certain characteristics. Now, as we go through these, think about your own health, whatever you might be working on. Now, a majority of deficiency conditions develop over time, so they're chronic symptoms. Of course, there's always exceptions, but that's typically what you see. Excesses can be either acute or chronic. So most of the list here, it's intuitive, makes common sense. You don't have to memorize it. So low-grade symptoms, deficiency. Intense symptoms, excess. Shrinking or contracting versus swelling. Hypofunction sounds like a deficiency. Hyperfunction or hyperactivity, that's an excess condition. So malaise, fatigue, and weakness, deficiency. Hyperreactivity, overstimulated, that's an excess. Underproduction, deficiency. Overproduction, excess. So again, these make intuitive sense. You don't have to figure out something complicated. So some examples here: mild versus intense headaches, low-grade fever versus high-grade fever, chronic fatigue versus restlessness. Okay, so hypothyroid versus hyperthyroid. All of those are sort of intuitive. Now, the amazing thing about defining health as strength and balance that manifests as an excess or a deficiency is that you can boil down the practice of medicine to 5 approaches that you can use to reestablish strength and balance. So let's go through each one just briefly, enough to get a lay of the land. We're going to go into them in a lot more detail in episode 3. So the first thing to do is eliminate whatever might be causing the problem. Now, even if that doesn't get rid of the problem it caused, it certainly makes healing a lot easier, right? Recovery is more possible. So this is what a lot of preventive medicine is focused on. This is one of the main areas of focus for naturopathic doctors, acupuncturists, functional medicine doctors, nutritionists, health coaches, some chiropractors. I'm sure I left somebody out. But if you read a lot of health articles, there are a lot about this particular topic. So poor diet, food sensitivities, lifestyle choices, toxic exposure, chronic infections, the kinds of things that can create health problems in the first place. So that's where you start. Why do I have this problem? Number 2 is supplementation and substitution. So if you have a deficiency, you're trying to fill a gap. So there's a gap there that you need to fill. If you have deficiencies in things like vitamins, minerals, or amino acids, you can take supplements to fill that gap. Now, substitution is taking something that the body should be producing, but it's not. So that would be like a diabetic taking insulin, or if you have hypothyroid, you're taking thyroxine. Even digestive enzymes or hydrochloric acid supplements, or you can buy them as supplements in the health food store. That's substitution. Now, the third is regenerate and upregulate. And regenerating when you have a deficiency is really the holy grail. So if you can regenerate whatever function is weak, like if you have a hypothyroid, and instead of taking substitution or thyroid hormone for the rest of your life, you would regenerate thyroid function over a period of time. It doesn't happen all of a sudden. It takes time, it takes effort. But that way you can cut back on the amount of thyroxine you're taking and eventually cut it out if you can really regenerate the function of your thyroid. So upregulating is different. That's where you're kind of trying to fill that gap in that deficiency temporarily with stimulants. So if you're tired, you're fatigued, malaise, lying around, lazy, maybe you get some coffee and it recharges you for a little while, but that is certainly a temporary fix. The fourth approach, remove or create obstructions or blockages, really it's more about removing for the most part. Occasionally you find something where you create a blockage to assist in some way. So that's like beta blockers, for instance, block the effects of adrenaline so that you can bring down your high blood pressure a little bit. That's the theory. But mostly you're trying to remove blockage with massage and acupuncture, and you can take muscle relaxants or vasodilation. There are a number of things you could do. Even a heart stent removes a blockage in your coronary artery. So that's the fourth approach. The fifth approach is reduction. And reduction is where a lot of drugs fall into this category. So anti-inflammatories, sedatives, diuretics, antibiotics, antivirals, many other drugs, as well as natural products, can reduce excesses. Right? So ice packs, even ice packs can do that. Now, all 5 of these approaches attempt to reestablish strength and balance. And you can use this roadmap to figure out where things stand and what you need to do in order to get better. And perhaps what type of healthcare practitioner might be best able to help you reestablish strength and balance. So if you get headaches, for instance, and you're taking something to reduce the excess, an anti-inflammatory, that's approach number 5, reduction. You might also consider, well, why do I have this problem in the first place? And you notice, well, I also have heartburn whenever I get a headache, and you realize your stomach is weak because it's not sending your food downward as it should. So you go to number 3, try to figure out how to regenerate the strength and the function in your stomach. Maybe you see an acupuncturist that gives you some tractylodes to strengthen your stomach, or look at number 1, causes, and realize, well, it's the delicious squares of hot, spicy chocolate that give you heartburn. Maybe you decide to see a naturopathic or functional medicine doctor to get food sensitivity testing. And in the end, if you get it right, you won't need the anti-inflammatory, which in the long term could cause liver problems. So we're going to get more into that kind of thinking in part 3. Part 2 is about defining susceptibility, definitely one of my favorite topics. So I want to thank Plantiva for making this presentation free for everyone. If you want a copy of this last summary page, you can go to plantiva.com and download and print it out for easy reference. So thanks for listening. May strength and balance be with you.